for our WIN, Role Clarity in Nursing, and we want that by September 2015. And we picked September because it's a bit of a critical time when we're looking politically. We've probably got a provincial election looming in the spring, so if we don't make some inroads with the ministry and with this government by September, we could be really challenged to do much with that going forward. Why? We want to do it for patient care and patient safety. Simple as that. This is not about turf protection. This is about evidence. It's about best practice. It's about the right thing to do and the right thing to do for each provider. And I think, you know, if we can get that role clarity going, that whole working together collaboration thing, that's all going to come together because everybody's going to be confident in what they're doing. How are we going to do that? We need clear definitions for that framework because that framework is an excellent start, but there's still some ambiguity in the language. Things like acuity. What does that mean? So we're going to need some clear definitions going forward and definitions that everybody can agree on. We're going to do that by advocating for ourselves, for our patients, and for care. And we're going to do that through a consensus that we achieve through regulatory bodies and other stakeholders, I guess, on roles and scope. Let's all just figure this out together.
Fantastic, thank you. Thank you for starting that off so well. Team 11.
This is an opportunity to say ditto. I don't know if it's because we're beside each other, but WIN wants role clarity for us. And WIN how for patient safety, ultimately that's why we work as nurses. And WIN how by being advocates for patients, public education, leadership from the ground up. Each of us have a responsibility. And we added the number 4, accountability.
Brilliant, brilliant. This is perfect.
Okay, we wanted to develop an empowerment plan, and we did that. And we wanted to be empowered by our managers. We want to empower each other, and we want to empower the patient. Why? Because empowerment will bring excellent patient care, high quality workplace. So how are we going to do that? We're going to do that by listening. And that means sharing and respecting and high-level communication. We also want to educate, and upstream and downstream. And we want to be fully engaged in teamwork as a collective, have a collective voice. Plus we want to have fun, we want to value each other, we want to be fully present and engaged. That's it.
Fantastic, these are wonderful. Team 9, always a surprising Team 9. Here you go.
So our WIN plan is to increase client and nurse satisfaction. Why? For better evidence-informed outcomes for all. And how? By following Florence Nightingale's steps, by shining our light onto the world, by thinking outside the box, and by showing leadership, education, and mentorship.
Well said. This is going well.
Hi, Team 8. I'm Cheryl from Stop. I got lucky to do this. So we agree with everybody, so everybody actually practiced a river dance for you. Ready?
Where's it go? Let's go.
No, we also agree with role clarity. Why? Again, it enhances and makes teamwork work better. Professionalism, so we know where we start and where we begin, and other workers do too. And also for patient safety, that depicts our education experience. How will we do this? Again, we agree that there is an election coming up, so we would like to lobby the government and professional associations. We also feel that education regarding our scope of practice is very important with the public eye. And also we talked about how we mesh in, especially when people are identifying on the role. So we do agree that we need to explain our role to our patients and families and residents, and also name tags are very important because they do read who you are. Thank you.
Thank you. Very nice. Very nice. Team 7, nice and loud.
We are Team 7, and our #1 was actually role clarity, but then we decided that that's a how. So win what is improved patient outcomes, win why for healthy communities and increased RN respect, and how are we going to do that? Toot Sweet, we're going to do every patient has the right caregiver at the right time. We're going to look at the strategic frameworks again, and we're going to do the client community engagement and involvement. Woo.
Very powerful.
So ours as well was role clarity. So the what, quality healthcare for Saskatchewan people. The why, to follow our professional standards and legislation. The how, best practice and evidence used to define all nursing roles, which will accomplish role clarity, we hope.
Fantastic. Team 5.
Okay, so we thought membership engagement. Our biannual member survey will be up, will be at 25% of the RN response rate. Why? So we can provide the SRNA with direction of where we want SRNA to go. We're going to win how is workplace representatives to advertise, let us know, more text boxes in the survey, and more emails, Facebook reminders, and just a shout out to everybody here to make sure you do the survey, and also for your remind and encourage your coworkers and colleagues to do the same. That's it. Thanks.
Perfect.
So we want to win leadership with clearly defined roles, and we want to win why for patient safety, and we want to win how leadership for RNs through collaboration. We want to empower RN leaders, and we want accountability for all stakeholders, and we want it by December of 2015.
Very well said. Very powerful.
We want to win role clarity of the RN, owning our own scope. Why for the accountability to the people of Saskatchewan, and how through leadership, evidence-based teamwork, and advocacy.
All right. Team 2.
So we also chose role clarity, more measurable amongst the RNs. This would be because we would like a better focus on patients and delivery of care. A lot of our time lately has been spent on this issue of role clarity, and if we could solve that, we could move on to the other issues that are surrounding our healthcare. We want to win this by owning our role among us RNs. We want to educate ourselves and others, as has been mentioned here before. We want to steal from our previous priorities is to model positive change to identify these roles.
Very well said. And team number 1.
It looks like our team got really small. There's only 4 members now. Just about every other team, we're the same. We have role clarity. And why patient safety, and also to acknowledge our unique contribution to the healthcare team. And many of our reasons are the same. We're thinking respect within the healthcare team and environment, and that's even like respect for ourselves and our role that we play. Identification of the RN, and leadership for nurses, and to lead by example.
Fantastic. Thinking, what did you see that you liked? Thoughts.
Sorry,
Thoughts. What did you see that you liked about those?
My thought is I think we are all very passionate and committed to nursing and to the registered nurse and the role and working collaboratively. And I think we all have a similar vision. We need to come together though, all members, and we need to strategically think, how are we going to move forward and get there? there is power in numbers and power with one voice. And we are definitely capable to move forward. And I've seen all the SRNA people on council taking notes. So thank you so much, because they will definitely take your some of your issues and your concerns and some of what you've said today to the government table. And also we will definitely be discussing this and try to strategize how we move some of your thoughts forward. So thank you very much. Great.
Thank you.
We are future!